You know, and I'm working an administrative role with Baptist Health. A large portion of what I do now deals with population health, patient-centered medical home, and you know, when you think of doctors and hospitals historically, when you get sick or you need services, you go there. But really, when you're there, we can only affect about 10% of your health. The other 90% occurs at home or in the community. So no longer is it good enough for us just to be there when you need us. Now, the hospitals, the physicians, the clinics have to reach out into the communities to actually help provide services and promote well-being for all of our citizens. In doing that, you know, there's numerous ways. We have started Project Fit, which funds healthy playground equipment in schools. We've started that 2 years ago. We placed a system at Longest Elementary. We placed one at Central City Elementary. We plan to continue that each year until we have one in each elementary school in the community. But this provides kids not only with healthy playground equipment, but it provides the teachers with the education of how to use that and how to teach the kids to use that so that we can get them active and moving and help promote weight loss and to keep them active. We have provide funding for the nursing education program at the high school, which relates back to workforce. And so even though we're promoting health, we try to be involved in all of these aspects that we're talking about tonight. You know, we have systems in place now where not only do we provide your health care, but now we can track to see if that's actually happening. Because if you are sick and come see me, I can write you a prescription. If you have high blood pressure, I can write you a prescription. But if you can't afford to get that filled and I don't know about it, have I really done you any good? So again, we have to know, is our patients getting their medicine filled? If we order labs, are they coming in and having those labs completed? If we refer you to a specialist, are you actually making it to that specialist? If the specialist is out of town, do you have transportation to get there? Because if you don't make it to those follow-ups, then really the care that we've rendered was no good in the first place. So with electronic medical records, and we just started a new one 2 weeks ago at our clinic, and across the Baptist system, we spent about $400 million on this electronic medical record. So it's pretty high tech. It's the same system that Owensboro uses. And integration, I think, is a large part in that, you know, the electronic records within Baptist Health and Owensboro Health are now integrated. So if I have a patient that comes to see me in Powderly and they've been anywhere within the Baptist system or the Owensboro system, we share those records. And that helps to provide better care for our citizens. We have a full-time nurse coordinator that works at our clinic that works on closing healthcare gaps. We get lots of reports from insurance companies. You know, if you miss a month on getting your blood pressure medicine refilled, or if you are supposed to get your cholesterol medicine filled after 30 days and it's been 40, believe it or not, they're sending us reports. This nurse will then reach out to those patients and say, hey, we got this report, you didn't get that medicine filled, is there a problem there? And in doing that, we can close those gaps to make sure, you know, if it's an insurance change that we need to switch to a different medicine, or if it's a cost issue that we need to switch to a lower cost medicine, even though it might not be the most effective, it's better to be on a lower cost and take something than to not be getting anything. So these are the kind of things that we're tracking now to promote health and well-being within the community. Before we had a nurse coordinator, we just simply didn't have time for that because we were so busy seeing patients that we had to focus on who was there, and that's all we could do. And now we're able to change that mindset, and we can see the patients who are there, but then we can also at the same time focus on the others that are out in the community so that we can start to affect that 90% that occurs outside of our office. To go into the workforce, which Gary talked about earlier, you know, we have to have a good clinic system, a good hospital system to attract industry in here. And part of that is occupational services. You know, we offer DOT exams. We're able to accommodate workers' compensation claims. You know, if somebody gets hurt at work, where do they go? And we have to have somewhere local for them to be serviced and seen. And you know, we're happy to have occupational services that allow us to do that. With Baptist Health, we have our own insurance company, which is Baptist Health Plan, and we formed our own accountable care organization, kind of getting into the future of medicine. Right now we are a fee-for-service industry. Somebody gets sick, they go to the doctor, you pay for going to that visit. But in the future, healthcare is changing to where insurance companies will say, okay, Muhlenberg County, you have this population of people, here's X number of dollars to take care of those people. You do it however you want to. If you lose money, you lose money. If you make money, that's good. But it puts us at risk, which is why now it's imperative that we reach out into the community to try to help and promote that well-being. If somebody goes into the hospital and they're discharged and they get readmitted to the hospital within a certain time, the hospital takes a penalty. So we have to make sure that we take care of our patients so that they don't get readmitted, because we don't want our hospital to lose money. And in doing that, it's where those of us that are outpatient work with those who are inpatient. And studies have shown if a patient follows up within 7 days, it's likely to reduce their readmission to the hospital. So now the physicians have to work with the hospitals to make sure that we're getting those patients in for follow-ups within 7 days, so that it helps to lower the cost of health care, but it also helps to make sure that the patient who was in the hospital is getting the services they need after they've been in the hospital. Because again, if they go home, they can't afford the medicines, or they don't go to the physical therapy or whatever else was ordered, then really we've done them no service. In doing this, we also share the risk with our providers. We've now written quality measures into our provider contracts so that, I get a report on each of our doctors every month, and we track their quality. And if our doctors aren't showing quality work, they suffer a pay cut for that. So now it's not enough to be there and see a high volume of patients, which is what healthcare has tended to do in the past. With most physicians, it was volume driven, and the more patients you see, the more money you make. And that's just not the case anymore, because at a certain point, you exceed a volume in which you compromise quality. And it's not good to see 50 patients a day if you can't, in a quality manner, take care of 50 patients a day. So we're reducing the numbers that the physicians are seeing, which will allow them to have more time per patient and provide more quality care to those patients. And then, we are looking at the blood pressure. I get a report on blood pressure of all hypertensive patients that come in. And if they fall out and it looks like their physician isn't controlling their blood pressure, then, as an administrative physician, I go to that physician and say, hey, look, you need to do a better job on taking care of our people that have high blood pressure. The same with diabetes, the same with COPD, every other disease state. So we're really monitoring those a lot more closely now than we ever have in the past. So again, that's some of what we're doing to promote well-being, and you will see us more active in the community. You will see us more active in calling patients after they've been in the hospital, even after they've been to see us for an outpatient visit.